All right, welcome back to another Wellness Wednesday. I'm Dr. Stephen Ramos with the HealthTexas Medical Group. I'm an Associate Medical Director. And Wellness Wednesday is a time where we have an informative video about important topics for your health in the community. So today I have a very special guest, Jeremiah, a local manager with United Healthcare, who's going to give us some information about open enrollment and AEP and everything going on with Medicare coverage. So Jeremiah, welcome.
Well, thank you so much for having me, Dr. Ramos. I really appreciate the opportunity. We're very excited. It's been a very good AEP annual enrollment period so far. Lots of new features, new benefits out there, and it's just such an important time for seniors to be aware of their choices and the changes that are coming up this year. So really appreciate the opportunity. Thank you for having us on.
Yeah, and thank you for being here. So one thing that get asked, people hear AEP and enrollment period, but what does that really mean? What's going on right now?
Sure. Well, the annual enrollment period for Medicare runs from October 15th through December 7th of each year. And what that is it's anyone who has a Medicare plan or is eligible for Medicare. That is typically their one chance during the year to make changes to their coverage for the following year. And so the annual enrollment period, it's a very important time, about 7 weeks, where they can look at the plans for the upcoming year. You can learn about any new benefits, any new features, and make those coverage decisions. Decide if something works well for you, or if you want to make a change to better affect your budget, your coverage, get you access to more things like dental or vision and other coverage like that.
Great. So I often have some patients where they either have, no idea what their coverage or their benefits are, or, they say, what, things are really good. I don't have any problems with my benefits coverage. I don't want any more information. I mean, is it still useful if you're pretty happy with your plan right now to talk to an agent to see what's out there?
It's definitely useful to know about the changes for each coming year. Every year, Medicare's always changing. There's always new things on the landscape. In 2020, of course, COVID-19 completely transformed just the entire healthcare world. And so it is really important to check your coverage. Make sure your doctors are covered. Make sure your drugs are covered. Make sure that you've got, that you're really maximizing, getting the most for your Medicare dollar, and that you're getting the coverage that you need to make you feel secure, that you understand it, and you know how to use it in the upcoming year, because that's what's important. It's getting into the doctor, it's staying healthy, it's maximizing those benefits like the gym membership, the transportation, and being aware of everything the plan offers, because it's there to help you live a healthier life.
Yeah, I think that's really important for people to understand what is covered and what benefits they have, because often they just go unutilized. I'll have patients that are catching a bunch of buses to come in and meet appointments, or doing these roundabout things where it's well, hold on, you have benefits here, we can
Absolutely.
get you connected.
Yeah, there's so many resources that HealthTexas provides, that the Medicare plans provide, that it's just very important to know and understand your plan, and an agent can help you do that. Your doctor, your clinic representatives can help you do that, because things like transportation, things like gym memberships, we added a lot of new premium options to our gym memberships this year. Places like Lifetime Fitness, Coco Fit Club, Pilates studios, real high-end fitness options that are available at no cost on most of our Medicare Advantage plans to our members. And so it really is exciting.
So you brought up a couple really good kind of new features that are going to be coming out this year for United. Can you expand a little bit more about maybe some other things that are coming down the road starting January?
Yeah, so on almost all of our Medicare Advantage plans for 2021, we've got zero premium PCP coverage. You've got zero premium cardiac rehab, colonoscopies and mammograms, whether they're preventative or diagnostic, are covered at zero premium. And really, the plans are designed to be simple and affordable, to maximize savings, but be easy to understand, and really are designed with this holistic idea to help you live a healthier life. The idea is to keep you healthy, keep you out of the hospital as much as possible, help you live a healthier life, help the healthcare system work better for everyone. That's United Healthcare's message. That's our mission. And that's why we work so well hand in hand with HealthTexas.
Yeah, I think one point you brought up that I love saying is, if I can keep my patients out of the hospital, I did a good job. And part of that is being able to coordinate and be on the same page with all the specialists, referrals, and everything that's going on. Your primary care doctor, it's really important that they stay very informed and kind of at the center and hopefully navigating our patients through this entire process, because it can be confusing. If you have 3 or 4 different doctors, you need this test and that test. Having a primary care doctor that understands these types of plans and these types of issues is just really crucial, because it can just make life so much easier. It limits errors and complications in the system.
Absolutely.
And then cost. Saving our patients money is part of keeping them healthy, so that they can. A lot of our patients are on fixed incomes, so that extra premium or copay at a doctor's office is important.
Yeah.
We have to consider that. So these are all wonderful things. How about choosing your primary care doctor along with kind of these Medicare plans? How important is that?
Sure. So let me touch on just a few things to consider when you're looking at a Medicare plan, because primary care doctor is absolutely essential. You definitely want to select a primary care doctor that's going to take a holistic look at your health and understand, get to know you, and who is going to help you use those plan features to, like you said, stay healthy, stay out of the hospital. I think it's also important to make sure that your prescriptions are covered. Make sure that the plan and the features are a good fit for your budget, are a good fit for your specific situation, because different plans, there's a wide variety of plan options. And so, looking at those, we've got plans specifically designed for those with diabetes, heart conditions, chronic heart failure. We've also got a plan for 2021 called our Patriot Plan that is really designed for those with veterans benefits, those who've served our country. They've earned their benefits, whether it's TRICARE for life or healthcare benefits through the Veterans Administration, but they're also able to, they've paid into Medicare like the rest of us, and so they're able to access the benefits of Medicare Advantage, the gym membership, the dental, the vision, everything that a Medicare Advantage plan has to offer, to supplement what they already have through the VA. And so we're very excited about bringing that in as well this year.
Yeah, it's great news. San Antonio being a very proud and populous
military city, USA.
Exactly.
Yeah.
So that's great news for our patients. The other thing, we as doctors, to be honest, don't know enough specifics. We can't stay updated, and to be honest, we have a hard time kind of even talking about insurance a lot of times. So we stay out of it. So we often will refer to you guys, our agents and representatives from the healthcare industry, to kind of help our patients make the right choice for them. So I know that a lot of my patients will get mail or phone calls and, hey, let's change your plan right now, and so forth. What I always tell them is, don't do anything like that over, mail or phone, because it's not personal. You may not be getting all the information you want. So what are the benefits of coming in and actually talking with a representative or an agent? Sure.
Well, there's a lot of benefits that a local agent can offer, and Medicare can be very, very confusing. It can seem overwhelming with all the options, like you said, so much in the mail, so many phone calls and commercials on TV. It seems like it's almost back to back.
Yeah.
But we are available to help make it very simple. If you can work directly with local agents. United Healthcare has a very large presence here in San Antonio and the surrounding area, really throughout Texas, and we're available to help people who have questions just navigate through their different choices, understand their options, understand the changes, even if it's just looking over your current plan to make sure you understand how it works. We have the ability to do that, to make complex things as simple as possible, take the time to understand, and a local agent's really going to do that. They understand how San Antonio might be different from the rest of the country. They understand who the doctors are here, how they work together, the different medical groups and hospitals, and how they interact with the various plan options here. And a local agent can really help you navigate that, as well as make the most of your local resources.
What are the best ways to reach out and to get in touch with an agent and schedule one of these meetings to get more information?
Sure, absolutely. So there's a lot of meetings going on at HealthTexas on a regular basis, where we have licensed agents who hold Medicare educational or Medicare sales presentations in connection with the clinics. So absolutely, give HealthTexas a call, find out when that next meeting is. Happy to set that up. Agents are also willing to meet one-on-one. And so reach out if you don't necessarily feel comfortable coming to a group meeting during this time. Agents are able to meet virtually. They're able to help you over the phone, in your home one-on-one, or over the phone, help you completely virtually, but walk you through those steps, help you make those decisions, and feel confident. That's the important thing, is feel confident in what you're doing. As January comes and as these new plans become effective January 1st, help you finally understand how the plan works, the benefits you have available to you, and really help you maximize that coverage in the coming year and get the most value for the money you're paying every month for your Medicare.
Oh, great. Well, I think that's all the time we have for Wellness Wednesday. Appreciate you guys for checking in and listening to Jeremiah. Thank you for a lot of really great information.
Yeah.
Do remember AEP is ongoing right now through December 7th. If you have any questions regarding your current status with Medicare or looking at some other options, give us a call at the number below. Visit any one of our 17 clinics, and we'll be able to provide you with that information. Thanks again. Y'all have a good day.